in clinical practice, sir? How people respond about the fatty liver?
Most often what we see is that patient doesn't know about MAs, definitely no. But only thing is most often what the people come is they do a master health checkup and do a ultrasound, and when they come with a fatty liver, they get scared of actually. In fact, they're so scared of fatty liver, they come and ask us what to be done for the fatty liver. But otherwise, I think most of the patients doesn't know there's something called as fatty liver. And I still remember about 20 years ago when MSL was not that popular, when we sent somebody to ultrasound, 85% of the people said it's a fatty liver. There was no MSL at that time. Fatty liver is the only thing. NAFLD was also not there. So we used to think that that they overdiagnosed. Like when you do echocardiogram, they used to say that there is some diastolic dysfunction. Diastolic. We used to say that they are overdiagnosing. That was the original thinking that we had. I think with more understanding and everything, I think this 85 to 85% of the diabetic patients are going to have fatty liver, definitely no doubt about that. The issue is that patient doesn't know. Only on routine checkup like ultrasound they come to know, and then they are worried about that, definitely. And they keep asking us what to do with this. That's what
I probably agree also. Most of the time they relate it to cholesterol, they relate it to something else, but patients as such, they have a very poor understanding of fatty liver. We all are aware that it's a premonitory symptom towards pre-diabetes symptom, but also we as doctors we are talking about pharmacology and things, but calorie restriction is the first starting point of treatment of fatty liver. So, or even putting it otherwise, calorie overnutrition is probably the starting point of fatty liver, and then you move on to type 2 diabetes. So, we are looking at a pre-diabetic symptom here. So, calorie restriction needs to be more talked about than anything else.
You're talking about patients' awareness. I think I've been seeing muscle checkup reports for more than 1.5 decades. I myself used to dismiss it. It's nothing much. So don't bother about it. And over a period of time, I realized my own mistakes. Just like what Dr. Lipaglyn said, that grade 1 diastolic dysfunction and fatty liver were the most common master findings. And we also teachers don't forget the ability of not taking action. So only with the period of time and the whole concept is concerned, we are now concerned. Obviously, we need more awareness. Patients also make them aware.
I think to a certain extent we have to appreciate pharma companies to bring the matter into a big prominence. Only then we started knowing about more and other things.
We need a drug to make it more prominent.
So, initially, what they thought was all